In our laboratory, we have been investigating what are the mechanisms through which IMiDs exert their effects against myeloma cells and become essentially an agent that causes cell killing. Now, we know very clearly that IMiDs need to bind to cereblon. It's a protein without which there's no IMiD activity. But we also know that the majority of patients that have IMiD resistance don't have mutations in cereblon and related proteins. There's been quite extensive studies in this regard. So we hypothesized that there might be other mechanisms, and indeed proposed that it is how proteins are handled by the cells that makes the difference in how IMiDs may or may not be effective. Now, how this works takes a second to explain, and that is that, when plasma cells, normal and myeloma plasma cells, are producing proteins, the chemistry dictates that they release a lot of free radicals, oxidative stress, and that is in the form of peroxide, hydrogen peroxide. Why that happens is because with each one of the disulfide bonds that is created, there's a molecule of peroxide being released, and it's so much that is in the range of 100,000 to 1 million molecules per second. So the plasma cells need a very good mechanism to dispose of this peroxide, and they have that through the thyroxine pathway. The thyroxine cleaves peroxide into water and oxygen, so makes them harmless to the cells. But to be active, it has to be kept whole, so to speak, by the thyroxine reductase, and we found that IMiDs inhibit the activity of thyroxine reductase. So we're trying to explore whether we could use this knowledge and start gauging how effective are cells at disposing of peroxide. And if the hypothesis is if they're less effective, then they're going to be more susceptible to the toxicity of this peroxide, which would be augmented by an IMiD administration, right? So we actually converted this to a flow cytometry assay. We had a publication this year where we show that we have some ability to predict that. Now, this study was essentially just the first of its kind. It needs to be confirmed. There's not anything that would be ready to be touted as a biomarker, but I think it's exciting to think that we may have a future where we can test patient samples and see if, in fact, we can predict IMiD sensitivity. I always say this is one of the biggest gaps we have in myeloma research. And the reason is that, as our patients are going through lines of therapy, for instance, someone who's facing, first relapse, and a physician may decide, I'm going to prescribe a combination of be that daratumumab or carfilzomib with lenalidomide and dexamethasone, and the patient responds. Was it the 3 drugs? Or could it be that only 2 of them contribute? So, for instance, carfilzomib and dexamethasone, and that the patient was not going to respond to an IMiD. And if so, then we're just adding toxicity and expense. So this is a very important area of research. Again, I can't claim to really have the answer at this moment, but we're excited to think that there will be a future where we can predict sensitivity to IMiDs.